Here's something that keeps me up at night as a urologist with over a decade of clinical experience. I've watched thousands of men over 50 walk into my office. Good men, proud men, men who built businesses, raised families, served their communities, and I've seen the look in their eyes. That mixture of embarrassment, frustration, and silent desperation. They've tried the little blue pills. Some worked, some didn't. Many came with headaches, flushing, and side effects they couldn't tolerate. But here's what shocks me most. The solution to their problem was sitting in their refrigerator all along. I'm talking about beet juice, but not by itself. You see, beet juice alone is powerful. It's been called nature's Viagra for good reason. But when you add one specific ingredient to it, an amino acid that costs pennies per serving, something remarkable happens in your blood vessels. The science calls it a synergistic amplification of nitric oxide production. I call it the difference between a man who's given up on intimacy and a man who feels 25 again. Stay with me for the next few minutes, because what I'm about to share could transform not just your bedroom performance, but potentially add years to your life. Let me ask you something personal. When you wake up in the morning, do you still experience those natural erections you took for granted in your 20s and 30s? If you're over 50 and the answer is no, or rarely, you're not alone. In fact, you're in the majority. Studies show that approximately 40% of men experience erectile dysfunction by age 40. By 70, that number climbs to 70%. But here's what most men don't understand, and what most doctors don't take the time to explain. Erectile dysfunction is not primarily a sexual problem. It's a cardiovascular problem. Your penis is essentially a blood pressure gauge for your entire body. The blood vessels serving your erectile tissue are among the smallest in your body, far smaller than the arteries feeding your heart. So when something goes wrong with your circulation, guess where you notice it first? That's right, down there. In my practice, I tell my patients this: ED is often the canary in the coal mine. It's your body's early warning system telling you that your blood vessels are struggling, that your blood flow is compromised, and that bigger problems may be on the horizon. The good news? This same mechanism that causes the problem is also the key to fixing it. And it all comes down to one tiny molecule: nitric oxide. Let me explain what's happening inside your body right now. Nitric oxide, we call it NO for short, is arguably the most important molecule you've never heard of. In 1998, 3 scientists won the Nobel Prize for discovering how it works. Here's what nitric oxide does. It relaxes and dilates your blood vessels, allowing more blood to flow. It prevents dangerous blood clots from forming. It reduces inflammation in your arterial walls. And it protects your endothelium, the delicate lining of your blood vessels. And for men specifically, nitric oxide is the master switch that initiates and maintains an erection. When you become aroused, your brain sends signals that trigger nitric oxide release in your penile tissue. This NO then relaxes the smooth muscle in your blood vessels, allowing them to expand and fill with blood. No nitric oxide, no erection. It's that simple. Now here's the problem, and this is critical for every man over 50 to understand. Your body's ability to produce nitric oxide declines dramatically with age. Research published in Hypertension Journal found that men in their 60s and 70s experience a 50 to 75% reduction in endothelium-derived nitric oxide compared to men in their 20s. Think about that. You're operating on a quarter to half of the NO production you had when you were young. Dr. Nathan Bryan, one of the world's leading nitric oxide researchers, puts it bluntly: loss of nitric oxide function is one of the earliest indicators of disease. If you can't produce NO, you can't dilate your blood vessels, you can't achieve proper blood flow, and everything downstream suffers. This explains so much, doesn't it? The gradual loss of firmness, the erections that don't last, the feeling that your body just isn't responding the way it used to. But here's the exciting part. We now know there are 2 distinct pathways to produce nitric oxide in your body. And if one pathway is failing, we can supercharge the other. Let's talk about beet juice. Beetroot is one of nature's most concentrated sources of dietary nitrates. A single 250 milliliter glass of beet juice delivers approximately 300 to 500 milligrams of nitrate, more than most vegetables combined. Now, here's where the magic happens. When you drink beet juice, the nitrates enter your bloodstream and travel to your salivary glands. Bacteria on your tongue, yes, the good bacteria in your mouth, convert these nitrates into nitrites. Then, in the acidic environment of your stomach and in your peripheral tissues, these nitrites are reduced into nitric oxide. This is called the nitrate-nitrite-NO pathway, and it's completely independent of the enzyme pathway that declines with age. In other words, even if your body has lost the ability to produce NO through the traditional pathway, you can still generate it through diet. Multiple studies have now confirmed the benefits. A systematic review published in Frontiers in Nutrition found that beet juice significantly reduces blood pressure by 3 to 5 millimeters of mercury in patients with hypertension. Research in the British Journal of Clinical Pharmacology showed improved endothelial function and blood flow, and smaller pilot studies have shown enhanced erectile rigidity and duration in men with mild ED. But here's what I've observed in my clinical practice. For many men, beet juice alone isn't enough. The effects are modest, noticeable, but not life-changing. That's where our secret ingredient comes in, the one addition that transforms beet juice from helpful to game-changing. The ingredient I'm talking about is L-Citrulline. L-Citrulline is an amino acid naturally found in watermelon. In fact, the name comes from citrullus, the Latin word for watermelon. But what makes L-Citrulline so special? While beet juice works through the nitrate-nitrite pathway, L-citrulline works through a completely different mechanism. It converts to L-arginine in your kidneys, and L-arginine is the direct precursor your body uses to synthesize nitric oxide through the classical enzyme pathway. Now, you might ask, why not just take L-arginine directly? Excellent question. And here's why L-citrulline is superior. When you take L-arginine orally, approximately 60% is broken down in your gut, and another 15% is metabolized by your liver before it ever reaches your bloodstream. Only about 30% actually makes it into circulation. L-citrulline, however, bypasses these barriers entirely. Studies show it achieves nearly 100% bioavailability, raising plasma arginine levels more effectively than arginine supplementation itself. A 2008 study in the British Journal of Clinical Pharmacology found that a single 3-gram dose of L-citrulline raised plasma L-arginine levels by 40 to 50% within 1 to 2 hours. But here's where it gets really exciting for men with ED. A landmark 2011 study published in Urology gave men with mild erectile dysfunction just 1.5 grams of L-citrulline daily for 1 month. The results? 50% of men reported improvement in erection hardness. The mean number of intercourses per month increased from 1.37 to 2.3. All men who improved reported high satisfaction and, critically, 0 side effects. More recently, a 2025 study published in Andrology, Open Access tested a supplement combining L-citrulline with beetroot extract on nighttime erections, those natural, spontaneous erections that occur during sleep and are a marker of erectile health. The results were remarkable. Men taking the combination showed a 47% improvement in erectile quality, measured objectively by wearable technology. The researchers concluded that combining no boosters that work through different pathways creates a synergistic effect greater than either alone. So, how do you actually put this into practice? Let me give you my recommended protocol based on the current research and what I've seen work for my patients. Step 1. Start with quality beet juice. Look for cold-pressed organic beet juice with no added sugars. You want approximately 250 to 500 milliliters daily, which provides about 300 to 500 milligrams of dietary nitrate. Timing matters. Nitric oxide levels from beet juice peak approximately 2 to 3 hours after consumption. So if you're looking for benefits related to intimacy, plan accordingly. For general cardiovascular health, I recommend drinking it in the morning with breakfast. Step 2. Add L-citrulline. The effective dose range in studies is 1.5 to 6 grams daily. I recommend starting with 3 grams. That's about 1 teaspoon of powder. You can mix the L-Citrulline directly into your beet juice. It has a mild, slightly sour taste that blends easily. Take it consistently for at least 2 to 4 weeks before assessing effects. The cardiovascular benefits build over time. Step 3. Protect your oral bacteria. This is something most people miss, and it's crucial. The nitrate-to-nitrite conversion depends on specific bacteria in your mouth. Using antibacterial mouthwash or fluoride toothpaste can significantly reduce this conversion. Research in hypertension showed that antiseptic mouthwash can blunt the blood pressure-lowering effects of dietary nitrate entirely. My recommendation: switch to a fluoride-free, non-antibacterial toothpaste and avoid mouthwash, especially within a few hours of consuming beet juice. Step 4. Consider the timing. For acute benefits before intimacy, take your beet juice and L-Citrulline combination about 2 hours beforehand. For ongoing cardiovascular support, take it consistently at the same time each day, preferably in the morning. Now, I must address some important precautions. Men taking nitrate medications like nitroglycerin for heart conditions should not combine them with concentrated nitrate supplements. The combined blood pressure lowering effect can be dangerous. If you're on PDE5 inhibitors like Viagra or Cialis, the combination with high-dose nitrates may cause additive blood pressure effects. Consult your doctor. Men with kidney stones should be cautious. Beets are high in oxalates, which can contribute to calcium oxalate stone formation. If you have kidney disease or liver disease, consult your healthcare provider before starting any supplementation protocol. Common side effects to be aware of include beaturia. That's the harmless red or pink discoloration of urine and stool. This surprises many people but is completely benign. You may also experience mild gastrointestinal discomfort at higher doses or temporary lightheadedness from blood pressure reduction. Seek medical help immediately if you experience chest pain or shortness of breath, severe headache or dizziness, or an erection lasting more than 4 hours. Before I close, I want to share something important with you. This isn't just about erections, it's about your life. Every study I've referenced, every mechanism I've explained, they all point to the same fundamental truth: your blood vessels determine your health span. When your blood flows freely, when your nitric oxide production is optimized, you don't just perform better in the bedroom, you think more clearly, you have more energy, your blood pressure normalizes, your risk of heart attack and stroke decreases. Research even suggests that sufficient nitric oxide may play a protective role in cognitive function, potentially reducing the risk of conditions like Alzheimer's disease. I've seen men come into my office defeated, men who'd given up on intimacy, on vitality, on feeling like themselves, and I've watched them transform when they understood that this wasn't an inevitable consequence of aging, but a fixable problem with a scientific solution. One patient, a 62-year-old retired firefighter, told me after 3 months on this protocol, "Doc, I feel like I got my life back, not just the physical part, everything. I have energy, I wake up feeling good, my wife says I'm happier, I didn't realize how much I'd been missing." That's what this is really about, so here's my challenge to you. If you're a man over 50 dealing with diminished blood flow, weakening erections, or just feeling like you're not the man you used to be, don't accept it as inevitable. Go get some quality beet juice and a container of L-Citrulline powder. They're available at any health food store or online. Together, they'll cost you less than a single dinner out. Commit to taking them consistently for 30 days. Track how you feel. Notice your energy levels. Pay attention to those morning erections. Monitor your blood pressure if you can. I think you'll be pleasantly surprised. And remember, this combination works through natural mechanisms your body already uses. You're not forcing anything artificial. You're simply giving your body the raw materials it needs to do what it was designed to do. If you found this information valuable, please share it with a friend or family member who might benefit. This is the kind of knowledge that can genuinely change lives. Take care of those blood vessels, gentlemen. They're taking care of you.